Welcome to Inservice Orientation, provided by Life Care Service Incorporated, located at 1723 Avenue M, Brooklyn, New York 11230. You can find us at the phone number 718-252-1515. Today we will be discussing fall prevention, emergency and disaster preparedness, infection control, personal protective equipment, HIV confidentiality, DNR order, and oxygen safety.
Accident and fall prevention. An accident can be defined as an unplanned event that has the potential to cause injury. Our best defense against injury is adhering to a program of safety awareness. Knowing hazards or potential dangers can prevent you and your patient from having accidents. Elderly people may not be as alert to hazards as we are. Their vision, hearing, and sense of smell may be impaired. It is our job to be alert enough to react quickly in the face of danger. Falling may be the most common accident for older patients, but you must stay aware for additional dangers such as burns, cuts, and fires. Let's begin with fall prevention. To understand fall prevention, we must first speak about the causes of fall. Causes of fall can be age, medication use, home environment, dehydration, low level of blood sugar, low level of blood pressure, vertigo, post-operative conditions, neurological disorders, cardiac disorders, infection, sepsis, UTI, improper use or absence of assistive devices, or if the patient has a history of falls. Common factors that can lead to fall are a history of falls. After people fall, they may not move around as much for fear of falling again. They limit their activities, which can lead to stiffness and poor coordination. Decreased range of motion and/or poor strength and balance. Chronic illness such as arthritis, strokes, lung disease, heart disease, and diabetes increase the risk of falling. Presence of urinary urgency and inconsistency. Many patients fall because they are trying to get to the bathroom quickly. Some of them fall because they are trying to get out of a wet bed. Wearing only socks or improper shoes. Often people fall because their footwear is slippery. Some older people wear socks to bed and then forget to put their shoes on when they get up. Vision. Aging leads to visual impairment, which can cause losing ability to see clearly. As mentioned earlier, medication use can cause falls. Medications that are known to cause falls are diuretics, beta blockers, ACE inhibitors, medications for diseases such as Parkinson's and Alzheimer's, antidepressants, or calcium channel blockers. Besides common factors that may cause falling, there are hazards in the home that can increase the risk of falls. It is best to know what those hazards are so you can easily avoid them. Let's begin with floors. Cluttered arrangement of furniture, loose throw rugs, and objects found on floors such as papers, magazines, books, electrical wires, and even pets. Lighting. Inadequate lighting in any area, especially near stairs, bedrooms, or bathrooms. Stairs. Clutter, broken or uneven steps, loose or broken handrails, torn carpet, or a light switch that is too far out of reach. Bathroom. Toilet seats that may be too low, slippery bathtub, no grab bars, no bath chair or bench. Kitchens. Poor placement of items. You should always remember, things used most often should be closer to waist level. Shiny or slippery floors. Using chairs as step stools, or spills not cleaned up. Bedroom. Beds that are difficult to get in and out of, bedside lamps that may be too hard to reach, no night lights. It is important for aides to assist patients in reducing these hazards as soon as they are discovered. Preventing falls in the home. Ask a patient to rise slowly from bed to sitting position. Make sure they sit at the side of the bed before getting up. When a patient feels dizzy, support the patient in sitting position and wait a minute or so till the dizziness goes away. At nighttime, using diapers and bedside commode decrease fall risk. Keep patient's personal items and phone nearby. Ask your patient to wait for assistance while dressing. During non-service hours, teach the patient to dress in sitting position. First, put on upper clothes and then lower clothes. Keep pathways clear and well lit. Remind patients with impaired vision to use glasses. Ambulate with walker or cane. Stay close to the patients when ambulates. If a patient is legally blind, do not change furniture arrangement. The patient moves by memory. If you go out with the patient, make sure to be a step ahead and to be informing them of what is in front. When you take care of a patient with balance problems or dizziness, stay close and a half step behind to help them, just in case the patient begins to feel weak, causing them to fall. Keep bathroom and kitchen floors clean and dry. Place a non-skid mat in slippery areas. Consider grab bars by tub and toilet. Tell a patient to take a shower during service hours. Make sure to check the temperature of the water before the patient takes a shower. If you work with a child patient, never leave the patient alone in the tub. In the living room, make sure to remove all clutters, such as stacks of old newspapers and magazines. Attach the rug's edges to the floor securely, if the patient does not want to remove their rug. Extension cords are a big danger. Get a long extension cord and place it against the wall. Here you can see some examples of assistive devices that prevent falls, such as shower chairs, roller walkers, grab bars, canes, bathroom handrails, and more. If you're present during a fall, what should you do? First, you should call 911. If the patient refuses the help of paramedics, you must then monitor them for 48 hours for symptoms of ICP. Symptoms are changes in the level of consciousness, headaches that don't stop, dilated or fixed pupils, or nausea and vomiting. Now that we understand the basics of fall and fall prevention, let's move on to infection control. Infection control and prevention must be a part of a home health aide's daily schedule. As a health worker, you have a huge responsibility to protect yourself, your family, and your patients from danger. You work in an environment that must strongly guard against infections. The people you care for are generally elderly, sick, and easily susceptible to diseases. What is just a cold to most people can be deadly to an older adult. Infection control and prevention is guidelines to be used when taking care of any patient. Infection control and prevention includes universal precaution, which is an approach to infection control that treats all human blood and body fluids. Standard precautions is a set of practices that is used to prevent transmission of diseases. There are several types of precautions: standard precautions, contact precautions, droplet precautions, and airborne precautions. Standard precautions are practices that all healthcare workers must follow in the care of all patients. They apply to blood, all body fluids, secretions, excretions that contain visible blood, non-intact skin, and mucous membranes. They do not apply to sweat. Contact precautions. This is the most common form of disease transmission. It can occur from direct skin-to-skin contact or indirect contact with contaminated object in the patient's environment. Droplet precautions. Use these precautions when a patient is diagnosed or suspected of an infection that can be spread on droplets of sputum. These germs travel a short distance of 3 feet and can cause infection when they land on your mucous membranes. Airborne precautions. Use when a patient is suspected of an infection that can travel throughout the patient's room on the air currents. Examples of these diseases are tuberculosis, chickenpox, and measles. Here you can find some disease-specific isolation recommendations for when precautions are needed. You can find examples for standard precautions, contact precautions, droplet precautions, and airborne precautions. Tuberculosis. Tuberculosis is an airborne disease carried on mucus droplets suspended in the air. When a person infected with TB talks, coughs, breathes, or sings, he or she may release mucus droplets carrying disease. TB usually infects lungs, causing coughing, difficulty breathing, fever, fatigue, loss of appetite, weight loss, night sweats, chest pain, coughing up blood, shortness of breath. If left untreated, TB may cause death. When caring for a patient with TB, you have to 1. Wear a special mask such as an N95 and a gown. 2. Ensure proper ventilation in the patient's room. 3. Remind the patient to take medication on time. 4. Use special care when handling sputum or phlegm. Universal precautions. Make sure to be cleaning with bleach, alcohol, peroxide, or white vinegar. The best process used to kill all microorganisms is disinfectant. Make sure to be using a disinfectant with a 1:10 bleach and water ratio. That is 1 part bleach and 10 parts of water. Clean and disinfect frequently touch surfaces on a regular basis. Properly dispose waste once you finish your job. Make sure to collect and roll used items away from you. Remove your uniform and place it into a secure bag before you leave. Keep in mind cough etiquette. Cover your mouth when sneezing and coughing. Make sure to wash the area after. To wash the area you sneezed and coughed in if it is and after you do so. Standard precautions. Hand hygiene. Hand hygiene includes alcohol-based hand washing with soap and water. Should be performed before and after contacting a patient, immediately after touching blood, body fluids, non-intact skin, mucous membranes, or contaminated items, even when gloves are worn during contact. Before eating, after using the restroom, before and after coming in contact with the patient's skin, after contact with soiled linens, before starting a shift or leaving a patient's home. Wear gloves. You must wear gloves anytime you might touch blood, vomit, urine, feces, or saliva, during assisting with mouth care, prenatal care, skin care, disposing of soiled bed linens, or pads. Wear a mask, gown, and goggles if you are coming in contact with blood or body fluids. Examples of personal protective equipment include masks, gloves, goggles, and gowns. Hand washing. When the skill test begins, the candidate is evaluated on his or her hand washing technique. The candidate is not told to wash their hands, but is expected to know that before physical contact with the client, his or her hands should be washed. Here are the steps you should take for hand washing. 1. Wet hands and wrist under running water to begin cleansing. 2. Apply soap to hands to begin washing. 3. Lather all surfaces of hands and wrist. 4. Rub soapy hands together for a minimum of 20 seconds. Keep hands pointed downward while washing and rinsing. 5. Rinse hands and wrists under running water to remove soap. 6. Use clean dry paper towel to dry hands and wrists. 7. Use paper towel to turn faucet off after hands are cleaned. 8. End procedure with clean hands avoiding direct contact with faucet, sink, and trash can. 5 important moments for hand hygiene are 1. Before touching a patient. 2. After touching a patient. 3. Before clean aseptic procedures. 4. After body fluid exposure risk. 5. After touching patient surroundings. Take a look at the chart for examples. Emergency and disasters. Emergency and disasters can be considered weather-related natural disasters that involve ice, snow, hurricanes, tornadoes, and floods, fire explosion, radiological or chemical exposures, biological event, community-wide epidemic, power outages involving electricity, heat, water, or telephone. Here are 4 simple things you should keep in mind during a winter storm. 1. Stay indoors for your safety and comfort as well as your patients. 2. Have a disaster supplies kit packed and ready in one place. 3. Assemble enough supplies such as food and water. 4. If you must go outside, make sure to wear several layers of lightweight clothing. It will help keep you warm. A jacket, gloves, and a hat will prevent loss of body heat. 5. Walk carefully on snowy and icy sidewalks. Here are 4 simple steps you can take during a flood. 1. Fill your car's gas tank in case of an evacuation notice. 2. Listen to local radio and TV stations for information and advice. If you are told to evacuate, do so immediately. 3. If you must evacuate your home, move to higher ground away from rivers, streams, creeks, and storm drains. If your car stalls in rapidly rising water, abandon it immediately. 4. Move your furniture, insurance policies, and other valuables to higher floors of your home. Here are some things you can do to prepare for a hurricane. 1. Make sure you have a battery-operated radio in your home to listen to hurricane progress reports. 2. Bring in outdoor objects such as law furniture and garden tools. 3. Secure the home by boarding up windows, as well as removing outside antennas. 4. Stay inside, away from windows, skylights, and glass doors. 5. Store drinking water in clean bathtubs, jugs, and bottles. 5. Set your refrigerator and freezer to the coldest settings. Stay prepared for a hurricane with this 72-hour emergency kit. In the kit, you should have water, food, manual can opener, flashlight and batteries, radio, first aid kit, car keys, house keys, special need items, cash, and a set emergency plan. Make sure to keep all your items in an easy-to-reach, dry, safe place. Basic needs and supplies in case of an emergency. Water, 1 gallon per person per day. 3-day supply for evacuation and 2-week supply for home. Food. Avoid buying foods that need preparing or refrigerating. Get foods that are non-perishable. For example, canned foods or dried foods. Get a flashlight as well as extra batteries and bulbs. Do not use candles. Make sure to have a first aid kit and manual medications, preferably a 7-day supply, as well as medical items. Sanitation and personal hygiene items, copies of personal documents, cell phone with an extra battery and charger, family and friends' emergency contact information, and 1 change of clothing. In case of a fire, remember the RACE acronym. R. Rescue. A. Alarm. C. Contain. E. Extinguish. R. Rescue. Assist anyone in immediate danger and help get them to a safe area as fast as possible. A. Alarm. Alert others by activating any available alarm system. Contact 911 to report location of fire and alert on-site personnel. C. Contain. Confine the fire as much as possible by closing doors and windows behind you during evacuation. E. Extinguish. Only attempt to put out the fire if it is small, you have proper equipment, and it is safe to do so yourself. Here's some information on Level 1 high priority patients. This priority level needs uninterrupted services in case of a disaster or emergency. Every possible effort must be made to see this patient. The patient's condition is highly unstable and deterioration or inpatient admission is highly probable if the patient is not seen. Examples include patient requiring life-sustaining equipment or medication, those needing highly skilled wound care, and unstable patients with no caregiver or informal support to provide care. Make sure to call the agency or nurse and report the status. Evacuation for mobility impaired. Do not evacuate by elevator. Do not move people who are dependent on mechanical equipment for their mobility unless authorized by emergency personnel. Call 911. Stay with the patient until emergency team arrives. Close as many doors as possible between you and the fire. Place a wet cloth under the door to prevent smoke from entering. Breathe shallowly through a filter such as a shirt or towel. DNR, do not resuscitate, also known as no code or allow natural disease, is a legal order, written or orally depending on country, indicating that a person does not want to receive cardiopulmonary resuscitation if that person's heart stops beating. Sometimes it also prevents other medical interventions. A do not resuscitate order or DNR order is a medical order written by a doctor, instructing healthcare providers not to do cardiopulmonary resuscitation, CPR, if a patient's breathing stops or if the patient's heart stops beating. It does not affect anything else about their care. A patient with a DNR order may still want every other kind of life-sustaining treatment, such as feeding. Keep in mind, medical professionals who give CPR to people with a DNR order can potentially be in trouble if they know about the DNR. HIV causes AIDS and interferes with the body's abilities to fight infections. It spreads by blood products, unclean needles or unscreened blood, mother to baby by pregnancy, labor or nursing, by having unprotected vaginal, anal, or oral sex. The confidentiality of a person's HIV status is important because people with HIV and AIDS face discrimination when other people find out that they have HIV. Any person involved in patient's care cannot share without patient's permission. In the event you are made aware that your patient is HIV positive, you cannot disclose this information to any other individual. State of law prohibits you from making any further disclosure of this information without the specific written consent of the person to whom it pertains. Any unauthorized disclosure is a violation of state law and may result in fine or jail sentence. General authorization for the release of medical or any other information is not sufficient for further disclosure. Oxygen safety. Never smoke or allow anyone else to smoke around oxygen canisters. Store oxygen canisters in an upright position. Store oxygen canisters in an oxygen storage rack. Keep oxygen 5-10 feet away from any type of heat source. Store your oxygen in a well-ventilated area away from the sun. Congratulations, you have made it to the end. Thank you for participating in Life Service Incorporation Orientation. Welcome to our Life Service team. We look forward to working with you, and we wish you the best of luck.